We found Dr. Frank Asiimwe conducting a lesson in urology with students of Makerere University School of Medicine. Some were master's degree students. His day sometimes starts as early as 4 a.m. and this small room, which can hardly accommodate a 6 by 6 feet bed, is his office.
I work in Mulago every day, every weekday I must say, from 8 to 5. At 5, instead of going to hang out with my friends, instead of joining my family as we go back home, I now go to other hospitals.
Dr. Asiimwe is a highly qualified urologist, holding 3 degrees in the field, a bachelor's and 2 masters, which he acquired after decades of reading and research. There are less than 50 urologists in Uganda, serving a population of over 35 million. But the consultant urologist says the government salary he earns can hardly foot his family bills.
So I would love my child to go to a good school, and good schools come at a cost. UPE schools you can pay 20,000 and your child is sorted out. So from my salary I probably can afford to pay for all my children in a UPE school.
Dr. Asiimwe's plight is shared by many doctors, especially those working in government health facilities. In the past, being a doctor was prestigious, and there is still perception in the public that this is the case. But Dr. Asiimwe says things have changed for the worse.
Now, a teacher of super specialist, when I enter a supermarket with my son by my side, he needs to point at something and I buy it. That's what I would want to do. But can I? No.
He explains that part of his meager salary includes transport allowance of 20,000 shillings, which can hardly fuel his car for a day.
The gauge reaches E. My children usually tell me, "Daddy, it is saying E." And I tell them, E means enough.
Dr. Asiimwe argues that if government continues to pretend to pay doctors, the doctors also pretend to work. And that has translated into absenteeism and presenteeism, where some doctors report on duty but no work done.
We're waiting for gowns, they're still sterilizing them. We're waiting for sutures to come. So instead of doing surgery from 8 to 4, my surgery begins at midday and the things run out at 2, and that's it.
This urodynamic machine, which measures pressure in the urinary bladder, has been lying idle here in Mulago National Referral Hospital for months due to lack of tubes, which cost less than $30, approximately 100,000 shillings. Poor pay, coupled with lack of equipment and consumables, is frustrating for doctors.
You bend and you see patients on the floor, no problem. You find there are no gloves. You say, okay, if the abdomen is not soiled with stool or other fluids, I will touch. And then you carry that infection home.
So what should be done to change this sad state of affairs?
Employ very many, pay them minimal, but commit them for a short time and allow them to go into the private sector.
The striking doctors feel that even as they do a noble job, saving and preserving lives, they are earning like peasants. Sudil Biarhanga, NTV.